Good day everyone. I'm Ethan, moderator for this webinar. Welcome everyone for today's webinar, CMS Physician Final Rule 2023. I would now like to introduce our presenter for today, Jan Rasmussen. Jan Rasmussen, PCS, ACS, OB, ACSGI. As a healthcare consultant, Jan has more than 45 years of experience in physician billing, reimbursement, and compliance. Jan is currently the owner of Professional Coding Solutions, a healthcare consulting firm. She has been a certified professional coder since 1992. As a member of the American Academy of Professional Coders, AAPC, Jan previously served on the advisory board as the liaison to the AMA, has been a speaker for the AAPC annual conference in 1994. She was honored by AAPC as Networker of the Year. I would now like to hand over the floor to the speaker. Over to you, Jan.
Thank you. I do have extensive experience working with coding and reimbursement and compliance. So today we're going to talk about CMS's final rule. CMS is Medicare, and this year, every year in January or before January, October, November, they publish a final rule. Prior to that, they publish a planned rule or anticipated rule, and they give time for comments from providers. But everything back in end of October, November, they do the final rule, and we need to pay very specific attention to that final rule because it tells us what Medicare is going to do starting January 1st of the following year. For 2023, the conversion factor for Medicare is 3306. So that's what we're going to deal with first. In 2021, CMS and CPT did a significant change in documentation reimbursement changes for the office setting. In 2023, they said, okay, we're going to extend those new documentation guidelines to all additional E&M services. So what did they delete? They deleted nursing facility services, annual nursing facility assessment, 99318. So what did they do with all these deletions? Well, they made combined categories. They have a new combined category for home resident service. They added a new prolonged service codes, GO318, if the patient is being seen in the home or residence. There's also a new prolonged service code, GO317, for patients in a nursing facility setting. All the new prolonged service codes for CMS have a minimum of 15 minutes by a physician or QHP, qualified healthcare professional. 9921, for example, 99215 has a range of 40 to 54 minutes. CMS changed the way they calculate prolonged service time for hospital visits. So watch your components of some categories for prolonged attendance, which does not match your CPT codes. So GO316, 17, and 18 have been added to the telehealth list. CMS's timelines for these types of things. So you're going to have to calculate all that time and make sure your providers understand this if they want to bill prolonged services. Another thing that changed didn't change in 2023, although they told us it was going to, split share care may be billed by the provider. Split share care can no longer be reported in the office setting. No split shared care in the office any longer, but CMS is saying in 2024, we're not going to use history exam and medical decision and making as a substantive portion. We're going to require time. Another thing they changed was colorectal screening. Telehealth. They made significant changes to telehealth. They're looking at extending the duration beyond the public health emergency ending, which is May 11th. And they're going to extend these to 151 days past May 11th. What they're trying to do is ensure a smooth transmission after the end of PHE, May 11th. They're going to require appropriate place of service indicator rather than the modifier 95 after a period of 151 days. Here's some of the things that were added to telehealth: physical therapy codes, CPT therapy codes. Telephone only 99441 through 443 will continue to be available for mental health patients. Chronic pain management is a whole new category. Now, the new code is G3002. G3002, minimum of face-to-face of 30 minutes. Each patient is going to be different, but you're going to have to make sure that you've got the outline of the basics to build G3002 or 3003. They're not limiting the types of physician specialties or QHPs. You must have patients' verbal consent. CPM can be billed in the same month as chronic care management, transitional care management, or behavioral health integration. G3002 has a value of 1.45. G3003 has a value of 0.5. Another new category, and I don't do much with behavioral health, but is a new code G0323 specifically for clinical psychologists and clinical social workers for monthly care integration. Here's the description. The work value is 0.61, and again, it follows the work value for 99484. Basically, CMS is trying to reduce barriers to mental health. They've amended the direct supervision in Incident 2 to allow behavioral health services for these categories to be furnished as a general supervision. Opioid treatments. Basically, they have not changed their opioid treatments. What they've done is they've looked at the cost, the payment amount for the methadone, the actual drug, and the payment amount will be changed to $39.37, and it will be updated annually. Opioid OTP programs increase the overall drug component for G2074. They're going to permit the use of audio only to initiate treatment with buprenorphine. Additional rules. Audiology. What they're going to do is they're going to allow beneficiaries to receive care without a referral for non-acute onset hearing or assessments. Dental and oral health services may also be covered for KX modifier. KX modifier is therapy caps. Skin substitutes. So these are some of the skin substitute codes. They're going to develop a uniform benefit category. They're also working on a change in terminology of skin substitutes. They're going to maintain the current treatment for skin substitutes for 2023. Discarded drugs. Basically, Medicare pays for certain single-dose containers or single-use packages when you don't use the entire single dose on an individual patient. Your FDA labeling will indicate instructions for users to discard unused portions. A large portion of the single dose based on patient's body weight. So what they're saying in this section 90004, so JW has been in place since 2017, and they're going to exclude radiopharmaceuticals and imaging agents. October 1st, they're going to start editing for use of the JW and JZ, and audits may be performed. Basically, they're asking what vial size should be used to calculate discarded. Okay, RHC and FQHC. They're now covered in RHC and chronic care. Now covered in RHC and FQHC is chronic pain management, G3002, and the new G0323, and it would be billed under the RHC FQHC code G0511. 2021 stated G0511 could only be billed once per month per beneficiary. Mental health visits may now be paid real-time audio video technology or audio only. They proposed removing all the 10 and 90-day global services to 0 days. And they're also questioning whether surgeons are transferring follow-up care to other providers. We need to make sure that we are aware of CMS changes when they produce the final rule. They usually produce the proposed rule in June, so you need to be aware of the proposed rules when they come out and the new final rule when they come out. Thank you all for attending.
Thank you, Jan. Thank you for your wonderful webinar. So thank you everyone for participating. Thank you everyone for being here with us. That's all for today. You all may disconnect now. You all have a great day ahead. Bye-bye. Take care.